Moving on to a continuous stitch, again with a non-absorbable suture, start at the end, which allows you to see the rest of the wound during closure, depending on whether you're right or left-handed. Tie a knot in the same way as before. Easing it down onto the skin and ensuring it doesn't pull too tight. Pass the needle in exactly the same way through the tissues, and depending on the nature of the wound, you may need to pass through one edge at a time, or if the edges are nicely approximated, it is acceptable to pass through both at the same time. As you move along your suture line, the visible part above the wound should leave equal diagonal sutures, as the line below the wound will have straight sutures perpendicular to the wound. The needle entry and exit points should all be equal, providing equal tension and a nice neat looking suture line. When you get to the end of the wound, tie a knot in the same way, using the loop instead of the short end. Remember to leave the knot on one side or the other of the wound. And leave enough length to allow for suture removal.